On July 5th, the new National Health Service starts, providing hospital and specialist services, medicines, drugs and appliances, care of the teeth and eyes, maternity services. Have you chosen your family doctor?
I describe myself as naively optimistic. I really do believe that we can achieve much more together than we can ever achieve as individual organisations or sectors.
So far, the National Health Service has been getting along remarkably smoothly. Indeed, far smoother than we dared to hope.
Now, moving into the new ICB space, we've been able to move forward on relationships, which are absolutely key, looking to innovate and really being guided by our frontline workers and clinicians and people who are actually delivering the services.
Millions of you have got the spectacles you needed, and tens of millions of you have visited the doctor under the scheme and got your medicine, and hundreds of thousands have used the hospital services.
People get better care and they get better healthcare where we work in conjunction and collaboration.
We have a real opportunity to do something very special for the people who work for NHS Kent and Medway.
The biggest change that I've seen is around the level of collaboration and the way the system has come together. COVID started that off and we saw some amazing collaboration coming through that. And what we've done through the ICB is we've managed to keep that momentum of partnership and collaboration. This is about taking it to the next step and bringing it outside of individual organisational boundaries, outside of team boundaries, much more collaborative, and much more focused around the needs of the patient.
Working together as a system, we've been able to tackle some of those bigger challenges we've had in the past. Ambulance handover delays, you really need the whole system to be able to work in harmony and maximise patient care and having patients in the right place for their care. We developed a team, they're called the Operational Control Centre, and they essentially are just monitoring live data. We can see if we've got ambulances starting to sit at a particular hospital. We are seen as a national exemplar for our Operational Control Centre, and they were implemented across the country last winter on the learning from Kent and Medway, so it's something we're quite proud of.
We want to know any information or any help, we can just ask, and the staff willing to answer all our questions.
The project is funded by the West Kent Healthcare Partnership. I've got Involve Kent coming here, we've got Maidstone Council Welfare and Benefits team, Citizens Advice Bureau are always on hand to help, so we can signpost people to lots of support.
I've lived on the estate 75 years, seen it alter, hell of a lot, but this is first class.
Kent and Medway, massive population, nearly 2 million people, but actually we're not interested in 2 million people. What we're trying to do is to work so that every individual gets their needs met, and that comes back to how we need to reach into our more disconnected communities, our more disadvantaged areas, so that they understand that things have changed.
I've been homeless for nearly 2 years, and I'd literally just been stuck on a merry-go-round of being accessed to mental health services, being hospitalised.
Porchlight is an organisation that works with the homeless. A lot of the clients don't have a lot to do with healthcare. The only times that they would have any interaction with healthcare is when they go into an A&E department.
Our role is to identify people in the hospital who are homeless. We talk to them about their physical health needs, their mental health needs. What we want to do is assist them into housing, but at the same time address the health inequalities that we can see so, glaringly obviously that are present in this group.
They said, no, we need to break this cycle. We need to find you appropriate accommodation. We need some space to breathe. You need some support.
To see the difference in the clients when we've seen them in a hospital bed when they haven't got a lot to look forward to, and then in their own places, it's fantastic. It really is lovely.
This is where our health and care partnerships really come to light, because they will be able to really work with those local communities and start to encourage people to manage their health and well-being in a different way. The local community and neighbourhoods are absolutely a priority if we're really going to see longer term impacts and outcomes for those kind of people. So I think those teams really will have a huge impact on those people.